Can you tell me a little bit about the service?
So we are the Surrey-wide Community Eating Disorder Community Service. So we are based in Epsom and we treat children and teenagers from all over Surrey. We are quite a large team, there's a lot of us here. You will see consultants and nurses and therapists. So we have CBT therapy, we have psychodynamic therapy, we also have family therapy. So there's lots of options and lots of different ways to help someone get to recovery and make a full recovery in our team. We generally see people weekly. However, for those that need more intense care, we offer that, and we might do home visits, we might do meals at home and also meals at the service itself.
And what should a young person expect the first time they come here?
So the first time a young person and their family come here, we kind of understand that it can be really quite stressful, really anxiety provoking. First time you come here, you might not really know what to expect. We generally ask for all the family to come. So that might be mum, dad, brothers, sisters. We kind of ask for the whole family to be here. First thing we'll want to do is kind of, especially as nurses, Kay and I are both nurses in the team, we want to check the young person's physical health. So we'll probably do your blood pressure, we'll check your pulse, we might do an ECG, we'll check your weight, we'll check your height, so just kind of get the really kind of physical stuff out of the way quite quickly so we kind of know what the risks are in terms of that. We'll probably ask you to do some blood tests, have some blood tests done at your doctor's before you come here as well, so that we've kind of got a bit of an idea of what's going on physically. And then it's quite a long morning, it's generally quite a long morning. What will happen is you will have two clinicians who will meet with you, your mum, your dad, siblings, whoever's here with you on the day, and we will kind of get a little bit of more of a feel of what's going on for you, what the problem is, how are things different, how have they changed, why are you with us today basically, and what kind of role might we have in terms of helping you. So we normally spend some time together, then we'll split up. So we normally do that for about an hour. And we will split up, so we will spend some time, one of us will spend some time with the young person and one of us will spend some time with family members. Then we'll go back to our MDT, our multidisciplinary team. We'll put all of our heads together, think about what's happened in the assessment, decide, does this young person have an eating disorder? Is it something we can help with? How might we help with that? And what else might they need? Then we'll come back to the young people and their family, explain what we have basically decided, and we'll come up with a plan. And you'll usually leave on that day knowing exactly what your plan is.
So what do you like about your job?
I think what I like most about my job is actually being able to meet lots of families and being able to meet lots of young people and see the progression over time.
That the thing I like most about my job is working with young people and their families. It feels like a real privilege to be involved with a young person's recovery from the time they come in, when things are really difficult for the whole family, and just being able to support them through a process that can feel really tricky at times, but ultimately seeing them get better feels really special to me, and I think that's the part that I value the most.
Disorders are really complex and they're very different. Every young person experiences it slightly differently, and I think what I like about my job is having the opportunity to get to know each individual and how their eating disorder affects them, and working out with them a really kind of personalised care plan that's going to work for them and their family. And I think that's one thing I really enjoy about my job, is actually getting to know a family and a young person really well. And I love my team. We've got a really big team, we're a really close team, and I think if one young person is really struggling, they're not just being treated by one person, they're being treated by the whole team. And I think that's really positive, but also I think what I love is that I know that we get people better.
What would you say to a young person who's worried that they might have an eating disorder?
I would definitely say to seek help. If you're really, it can be really, really difficult if you're not sure what to do, and it can feel quite confusing and quite scary. Definitely speak to parents, friends, teachers, and who can hopefully encourage you to go to the GP if you haven't done so already. The GP can then help you get in contact with hopefully a service like ours for extra help, and we can help you through.
And what would you say to a carer or a friend who suspects that a young person has an eating disorder?
I would say go and find some help as soon as you possibly can. So either go and tell your parents or go and tell the parents of the young person, who should then take their young person to a GP. If you don't want to go via your GP, you can always self-refer to us. You can ring up and talk through what's going on. It has to be the young person or the parents of the young person who rings us up though. So if you are worried about someone else, you need to make sure that you have a conversation with their parents first.